Hello everybody. आज का वीडियो थोड़ा अलग है. Today is a different video because let's face it, the whole world is facing a pandemic. Or I figured this is something I want to talk about to tell you what's happening in the United States of America and how we are prepping for it. And I think this is something everybody should know, and I'm sure everybody is following the news. And whatever I'm going to talk about today is not my opinion. It's all based off of two organizations. WHO, which everybody knows is the World Health Organization. It overlooks the entire world. And the CDC in the USA. And for those of you who don't know what CDC is, CDC stands for the Center for Disease Control and Prevention in the United States of America. So if you see me looking at something, these are my notes, or if I look at my phone, it's because I'm looking at the CDC website. So I am not going to be giving you my opinions. These are some of the things that people have questions about, and these are answers from either World Health Organization or CDC. So let's start with what is coronavirus and why is it named as corona. So coronavirus is a group of viruses, coronaviruses family, and it's not new. There are some of these strains of viruses that usually cause like common colds or things in humans, and then there are some viruses from the same family that cause diseases in animals. Now this coronavirus is a new strain because this has not been previously seen, and this seems to have transmitted from animals to humans. I don't exactly know what they finally decided, because I think, like all of you, it was said that it jumped from bats to humans, but then there was talk about snakes being involved, things like that. So I don't know about that, but it's definitely from animals to humans. And the name corona because when you look at the virus under a microscope, it looks like the virus has a crown on its head, or like the corona of the sun. So that's why it's named coronavirus. And the other name for this is also, the disease is called COVID-19, COVID-19. And why is it called COVID-19? CO stands for corona, VI for virus, and D for disease. And the number 19 is because the first case was reported in 2019. So that's the general gist of the virus itself and the disease. Now, just a few days ago, World Health Organization declared this a pandemic. And what is a pandemic? Before that, I just want to tell you something. I will link everything in the description box below, and it will also have some slides pop up which will give you more information. Usually there are three designations: outbreak, epidemic, and pandemic. And again, this is from World Health Organization, and please go to the website for exact descriptions. But outbreak is when it happens in a very localized area, the disease that happens in a very localized area. Epidemic is when it's in one area, but then it spreads a little bit in like a couple of other places or so. Like, that's what I think. And pandemic is when the disease spreads to more than 2 countries, I think, or I could be wrong, but please do check it out. It starts in a region and then it spreads. And with COVID-19, you know that it has spread in a lot of countries, and that's why World Health Organization described it as a pandemic. So just a few facts of why it's been called a pandemic. I will insert a slide here that describes what's going on in the world. So as of today, I think the World Health Organization's website updates the cases as over 152,000 people. हिंदी में 1,50,000 से ऊपर लोग affected है, with more than 5,700 deaths all across the world. And you can check the website for more accurate description, and it will also give a breakdown of what countries have been affected and what the number of cases are. In the United States, it has affected almost all states except for, I think, West Virginia, Alabama, and Wyoming, I think, and Alaska. But the most affected states are Washington, California on the West Coast, and New York on the East Coast. But you also have to remember, if you look at the map, that most of the cases are concentrated on the East Coast and the West Coast, because those are also the most populous places in the United States. It's not as populated in the Midwest area. But that's why it's very important to treat this carefully and listen to the government, listen to the health professionals, listen to the government bodies. So the symptoms that have been identified as surety of COVID-19 are cough, fever, and shortness of breath, because it affects the respiratory system. So what has been told is that people with less immunity, elderly, or with underlying health conditions are more prone to have the severe cases, because if you're healthy, you might get it with like very mild symptoms. And it is said that you could be contagious more when the symptoms are there, but there have been cases where even with very mild symptoms or no symptoms, there have been people who have been contaminated. So this is a reason to be concerned, but not to panic, because I think the governments are doing everything they can to protect us, the people. But as a community, I think it is very important for us to do our part. So what are some of the things you can do? Washing hands. And washing hands is important because it's not what kind of soap you use, it's the process itself. When you wash your hands with some kind of soap and water for at least 20 seconds, in the US it's considered, if you sing the song Happy Birthday 2 times, then you're good for 20 seconds, or just count till 20 seconds, like 1 Mississippi, 2 Mississippi, 3 Mississippi, and so forth. So what happens is, with the water and the friction and the soap, it takes away anything that's on your skin, oil, dirt, grease, germs, etc. It washes it off. Now you don't have to have like foaming soap or liquid soap. You could just use a bar soap. So please don't go panicking and buy all the soap, liquid soap in the store, because what's happening is people are hoarding it. And you have to remember that not only you, but others also need to do the same. It's kind of like, you could be the best driver on the street, but if everybody else is a horrible driver, you are going to get into an accident. So please be considerate about others. And yes, in the US, there are a lot of restrictions now. I think travel has been put on hold from the European countries, UK included, but again, check the CDC website, they'll give you the latest information. I personally have been told to work from home for a month. Schools are imposing remote learning, and all this is being done to limit the exposure, because what is happening, like in Italy, why it has become so overwhelming for the country is when a lot of people get sick at the same time, it overwhelms the medical system and the healthcare system. So we should do our part and kind of adapt social distancing. Social distancing is not going out in crowds, not meeting people. You have to be cautious, washing hands, using hand sanitizer, anything you would do on a regular basis, right? Even when you have the flu season or so, washing hands, disinfecting should be something we do on a daily basis. And this is not the time to be embarrassed. If any of you or anybody you know is experiencing these symptoms, especially, please do contact your healthcare professional. And we all need to work together as a community to get over this, because that's what makes us human, right? So I know this is a very different video from what I usually do, but I really wanted to sit down and talk to you because I do care about my family, my friends, my coworkers, and in general. So I hope all of you stay safe, be cautious, be smart, not panic, and follow the directions given by your government. And because this could be such a sensitive topic. I am going to disable the comments for this video, but again, whatever I have mentioned is from the CDC website or World Health Organization. So please do check them out. They always update their websites, and let's get over this together and come out winners. So stay safe, have a wonderful time with your family if you're staying home, and always remember to live, love, laugh, and dare to dream. I love you all. See you in my next video. Bye.